Hello everyone. My name is Kenny Meesters, and on behalf of my co-authors Joris Wijnen, Mats Visser and Kees Boersma, I would like to present our paper to you entitled The Challenge and Value of Dashboard Development During the COVID-19 Pandemic. So in our paper we've looked at the role that dashboards play in the COVID-19 response, and specifically we examined that in the Netherlands, among others in the National Operational Team Corona, from which you see a picture here where students of ours are discussing information needs and systems with the colleagues from the emergency response agencies. So to present our paper to you, we like to talk about three different things in this presentation. The first one is the context and the motivation for our research. The second one is the actual research setup and the data that we collected, the theoretical foundations. And finally, what we've learned from that data in our results and conclusions. So first, let's talk about the need for information. Simply put, when we're dealing with information in a crisis, this is our objective: providing the right people with the right information at the right time in the right format so that they can make informed decisions. This does not only apply to policymakers and emergency agencies, but also to affected populations, NGOs, civic initiatives, and so on. Everybody's making decisions and everybody is seeking information to make an informed choice. However, this is not trivial. In a crisis, there is limited information, especially when you talk about sudden onset emergencies or unexpected events, the black swans or the high impact, low probability events. In these events, there is limited information in the beginning and a high degree of uncertainty. So that means that we have to take decisions based with very limited information on intuition or experience. As the Prime Minister of the Netherlands said in the beginning of the COVID-19 pandemic, in a crisis you have to make 100% of your decisions with only 50% of the information. But as a crisis goes on, we might still not have the information, but at least we start to understand where the information can be found, what information do we need, and how do we put it together. In other words, we start developing an information management strategy. We're putting systems, procedures, and the right people in place to get the information from where it is to where it needs to be. As the situation stabilizes, we start using these systems to start establishing a continuous flow of information and linking this to decision making. That doesn't mean that the crisis itself is resolved, it just means that the information flows have stabilized and that there's information systems put in place. Now, this of course very much depends on the emergency, how this diagram exactly evolves, and whether it's like COVID-19 going around in waves for a longer period of time, or a sudden onset emergency that happens once and then we start the recovery. Nevertheless, the goal is to move these curves as much to the left as we can to get us quickly to this stabilized understanding of the situation and this flow of information. So one of the ways that you might have seen this in the COVID-19 pandemic is these dashboards. The COVID-19 dashboard from Johns Hopkins University, the World Health Organization, and every government around the world has published dashboards on their website. Including the Dutch government, and there was even mention of a dashboard pandemic because everybody was making and having dashboards with all kinds of information. So why did this happen? Well, first reason is that we have more data that we can work with. Even in our daily life, a lot of the data is available, standardized formats, open access. That means that we have more access to data that we can use in dashboards. Secondly, there is more possible in terms of development of dashboards, in terms of visualization, in making them accessible, making them interactive, in processing the data. So the technological possibilities have increased. Third, not only have the possibilities increased, the possibilities have also become more accessible. That means that they've become easier to use, that they don't require expensive investments in terms of hardware and software anymore, especially with the cloud. And thirdly, that people have been trained more in using these technologies. Every university around the world today is teaching some course of data science in their curriculum. Kids learn to program in schools. So the technology has become more widely used. And finally, we're also just the general expectation that we can use information technology to help us make decisions. In our daily lives, we've become accustomed to data being available, presented to us in an easy format that we can use to make our decisions. So in a crisis, this expectation, this need for information, translate to also technology helping us to make decisions and navigating, especially when we're dealing with such a high uncertainty. Nevertheless, there are some things that are different in a crisis. First of all, the data availability. I know we just said that a lot of data is available, but that goes for data that we know and that we can use. Of course, in a pandemic, we know we can count the number of infections and we can report on them through hospital systems. However, we might not know exactly what socioeconomic effects to monitor, how to monitor public health perception, well-being, economic effects, and so on. So that takes time to understand what data do we need, how do we get it, and how can we put it together. Secondly, we don't have the resources that we have at normal times. In a crisis, often the demand is overwhelming and the resources are limited, damaged, people are not available, and so on. That means that we have to make deliberate choices in what to invest in and what not, including information management. So the question is, can we free up enough resources to start working on information systems such as dashboards? There's also this technology push. This is because people want to use technology, not just for the intrinsic motivation of helping them to get better grips on the data, to get access to the information or help in the decision-making process, but also, again, because of these expectations. If one agency starts using dashboards and they get attention for it, other agencies want to show that they're also in control, also start developing dashboards. And it can even be almost like an arms race. In other words, the expectations and the push of the promise of technology is an external motivator just to show you're in control and you have the information. And then finally, there is the question, do we use dashboards at all in the decision-making process? Often we see that decisions are being made and the data plays a secondary role in it. For good reason sometimes. We're not always making rational decisions in a crisis. It can be because of public perception, emotions, image, and so on. So data and the role of data and thus dashboards in the decision-making process can be limited. So this leads us to our research. What is the added value of developing dashboards in a crisis, and specifically the development part, investing these resources in a time of scarcity? And if you start developing dashboards, what challenges do you encounter in the development and use of these dashboards? If they are this promised, what stops us from leveraging that potential? So this brings us to the next question about the next topic, our research. So first, we've developed a theoretical underpinning for our research, which is based on three components: the crisis context, understanding what's going on, the decision-making that's happening, so the crisis management, and finally the role of information in. If I would put this in a different way, you could say there's the crisis context, the pandemic. There's the management of the pandemic, so the people, the crisis emergency responders that are making decisions, and the information that they use, such as dashboards. So if you look at this way, it's almost like a driven the development, right? There's a context, we need to make decisions, and we're looking at information systems to help us make better decisions. If you reason the other way around, we'll start looking at the impact. We have these dashboards with information in them. Are they being used by crisis managers, and do they help to make better decisions to alleviate the situation? So this two-way diagram that we're looking at is the development and the actual impact. So to do that, we started examining existing dashboards, and we made a rudimentary classification, starting from dashboards that are being used internally for policy making, high-level decisions for future, for measures that need to be put in place, for resource mobilization, and so on. We also looked at internal dashboards that are more used on a daily basis, for example, resource allocation, distribution, infections, and so on. And finally, we had a category of external dashboards that are meant for public communication, just to inform the public about what's going on. We also had another category of classifications where we could see the different stages of the dashboards during the development cycle. So the first one is in the startup and the initialization of the dashboard. Second one is the continued use of the dashboards. And finally, once the dashboards are no longer needed, what happens next in terms of scale down and handover. So to give you an example, a few examples, we have the COVID-19 dashboard. This was in the development in the early stages of the COVID-19 response by this operational team that I showed you in the beginning, that really was meant to understand if the critical infrastructures of the country are okay, where are the potential interventions needed, and so on. We also had the public dashboard that was from the beginning and was used for a long time, so really in this continued use, meant to inform the public about the number of infections in the Netherlands, the hospital occupancy, and other key indicators. And there was also really a tracking app, as in many countries, that was partially meant for the public to understand, when you would get in contact with somebody who was affected. But the data was also, of course, very useful for policymakers to understand what measures were effective and how they would stop the spread of the infection. Nevertheless, this last part is not always the tracker was abolished at some point during the COVID-19 pandemic, so really came into this scale down and handover. So with this classification, we started examining the potential, the impact of these dashboards, and we've done this through 3 different data collection methods. So first one is that we did a mapping of all the dashboards that we could find, public and closed, through our contacts, and we started putting them in the framework. Second one, we approached the people involved in making, using, and developing the dashboards to present them with a survey. And we presented them in the survey with different dilemmas in the different stages, which I show to you in a minute. And finally, for some of these dashboards and some of the survey results, we conducted interviews to get a better understanding of the dilemmas that they faced, the value that they derived. So all of this, the details of this research and the data collection are in the paper itself. But let's go ahead to the final part, which is what we found here. So just to structure a little bit, let's go through the stages that the dashboards go through. So in the initialization of these dashboards, there are different dilemmas that people have to weigh. I won't go through all of them, but one of the things you really see is the question, should we focus on something that is architecturally sound or something that's visually appealing? And here, a lot of times developers say, well, we don't know what we're doing, so let's at least build a good structure here. So that's really an outlier. And again, this is a bit at odds with the speed of development. So it needs to happen fast, and you want something that's architecturally correct. So there's often a trade-off needed. And what you see when the dashboards start developing is that it's not always clear why are we doing this. So in the interviews, it was mentioned to us that they didn't understand the goal, the objective that was needed, and in fact that objective kept continually changing. Often the assignment was we just make a dashboard, but what requirements, what the users were, the stakeholders involved kept changing, and that made it very difficult for them to make decisions in the early stages of development. So that also led to a lot of sometimes frustrations where developers were asking, why do we need to do this? Or why do we want to know this? Again, because time and resources are constrained. And if the people wanted to be effective, they had to understand what they wanted, what the goal was, what wanted to be accomplished with the dashboard. So in the continued development, this came back. Something was put together, different spreadsheets in the beginning, even in a day, but they never give much thought to proper data structures. It was merely putting something together that they had. But then as the crisis evolved and the actor landscape and the information landscape became more complex, it became harder and harder to put the structures together and manage it all in one dashboard. So it required more involvement. What is interesting, though, is that over time, people prefer accuracy of data over more data. So especially for decision makers, they weren't really involved in how much data was behind the dashboard because they couldn't often see it at the front. They were much more interested if the data was a good representation or not. And the other element that really contributes to the development is that often there were new teams, different companies put together, different developers that haven't worked before, that now needed to come together from different agencies. So that was also a dynamic problem that had to often be overcome in the development. And then in the scale down, what is interesting is that a lot of the dashboards were shelved. They weren't used, they weren't reused, they weren't put in a specific place in the organization. So when asked what's going to happen next, a lot of the respondents said, we don't know. I think it's taken apart. Maybe other people will continue it. But the dashboards itself, there's little done. However, they did indicate that just the process of developing a dashboard was very valuable to them. The conversations they had, the insights they've gained. So the experience and the gain from developing a dashboard was really appreciated by information managers. So this brings us to maybe 4 main conclusions that we have in the paper. First of all, that dashboards are not a fixed item. They can and they will change over time. They're dynamic. As the crisis changes and the data changes and the information needs change, so do the dashboards. And it's also because they can be easily configured, and this actually with new technologies becomes increasingly easy. So dashboards, they evolve alongside the organization. The motivation, however, for developing a dashboard initially is often external because other people have dashboards for public image, for reputation. So the actual use in decision-making process is often limited. Often decisions have been made and they're looked at to see if they are coherent with the dashboard. A sort of justification or the dashboard are used for public communication. But very limited are they directly linked to the decision-making process. And often people don't understand what is needed to make a good dashboard. The question is make a dashboard, but it does require you to invest time and resources, including those of your decision makers, to articulate their needs. And this is not always understood. However, the development process itself is very valuable. If you don't look at the dashboard as the resulting artifact itself, but rather as an artifact that encourages continuous conversation, it is a certain value. You can take building blocks, templates, and dashboards that you can reuse in the future that can provide a valuable basis. Moreover, the capacity that individuals, teams, and organizations gain can be transposed to future emergencies. So it's not the dashboard itself that might be used, but rather the capacities you've gained by making one along the way that are valuable. In other words, dashboards, the main value here is capacity building for information management. You can use dashboards as a bridge to have a conversation between the data engineers, the data scientists, the information managers on the one hand, and decision makers on the other. It helps to articulate the information needs. Even if you don't make a dashboard, just even a mock-up might help to understand what information is needed. In other words, the dashboard is a way to implement this, how to get the right information to the right people at the right time in the right format. A dashboard can help you specify what right is in that statement. But in closing, we wanted to say that this is of course preliminary research, and you might wonder, is this really something that's specific to dashboards? We don't know yet, but in our opinion, it's not. Increasingly, we see technology being used in emergency response. Dashboards is one of them, but even including AI, machine learning, data science, all kinds of other information management techniques are being employed. So this research might very well transpose to other forms of artifacts that help with information management. And this is definitely something we want to explore in the future. So if you're interested in that research, please do contact us. If you want more information, you can check on the research, you can check our paper. We hope you enjoyed this presentation, and thank you so much for listening.